Guys, it's me, Kate. I wanted to give you a quick update, scan update really. So last Wednesday, Mum took me for my CT scan, which is the first one I've had in a while. In fact, the first one I've had since starting chemotherapy. They did manage to use my PICC line for it, so that was good. But I went to see my oncologist yesterday, which was a bit of a three-pronged thing because one, he's my new oncologist, so it's the first time I was meeting him. Two, it was actually my normal 3-weekly checkup to see how I'm getting on with chemo, because you have a checkup with the oncologist every 3 weeks just to see how the side effects are, if you're managing, if they need to do anything differently, all that sort of stuff. And then three, it was to get my CT results because my secondary breast cancer nurse, Sue Sharp, had chased them for me to make sure that they would be available for that appointment. So as I'm sure you can imagine, it was with some trepidation that Tim and I trotted off there yesterday for an appointment at 2:30. And I have got really, really mixed feelings about it. So the good news is, and there is good news, that it shows that the chemo is working. So two of my liver tumours in particular, I have quite a few, but two of them, bigger ones, one has reduced from 2.7, I want to say, to 2.1 millimetres, sorry, centimetres, yeah. That would be really small. And the other one has gone from something like 1.6 centimetres to 1. So that's really good, and it shows that the paclitaxel that I'm on is working. Dr. Price had thought that that would be the case. He was my previous oncologist who is now retired to Bermuda, because of my blood results. But to be fair, I was just not believing anything until the actual scan results came through. So it's great to know that the paclitaxel is working, and what we've agreed is that I will have this week's, which is number 12 of 18, and then I will have another 3, and then I'm going to have a week off just to give myself a little bit of a break. And originally I had just wanted to sort of like plough through them and get through the 18, but I'm not so fussed about that now, and I'll tell you why in a minute. So it means that I can have a week off, which will be great. And obviously they said, you know, my energy levels won't necessarily be back to how they are normally, of course, but it should mean that I'm feeling a little bit better, which hopefully should then mean that Tim and I can maybe just go away for a couple of days and just have some time out, because as I was sort of saying to Sue Sharp yesterday, because Tim and I then, after we've seen the oncologist, we always go into a separate room and have a chat with Sue, and she talks to us in a bit more detail about how I'm feeling, how I think the appointment's gone, you know, what my thoughts are after what I've been told, what, you know, how Tim is, and all this sort of stuff. And I just said, to be honest, it would be nice if Tim and I didn't feel like patient and carer, because unfortunately that is what it is a lot of the time. We are still us, but Tim is having to do probably even more for me than he normally would. And I don't really like that, because I do like to pull my weight, probably not as much as he does in all fairness, because anyone who knows me knows that I don't do any of the cooking or anything like that. But yeah, it's hard work for Tim. You know, he's working and then he's having to come home and do a lot of extra stuff, as well as bear the emotional weight of what's going on. So to have that week off actually is hopefully going to be a good thing, and it means that we can get away. But in terms of mixed feelings, I was hoping, obviously I had a huge wave of relief when he said it was working and that the tumours had shrunk, and that is totally brilliant, because who wants to be stuck on chemotherapy feeling crap and going through all these symptoms and having no hair and goodness knows what else if it's not actually doing anything. So it's brilliant that it is. However, I think in my little head, I thought that this would blast them and that they would be gone. Now, I know I'm never going to be clear of cancer, but I was hoping that I might get to that point where I would be at what they might call no evidence of disease. And so effectively that would be like stable with like nothing, like no tumours. So the cancer cells are always going to be there, and they're always going to start creating tumours at various points, unfortunately. But I was really hoping that I could get to a point where I just sort of didn't really have any inside me, not the cells, but like the tumours. So mentally, I've been sort of having to get round that and actually just realise that this is all just about control and management for as long as possible, and for as much time as I've got left. I think because I had stability for like 11 months, which was great, and actually the tumours I had were really tiny and quite few and far between, and my bones had improved with the radiotherapy. And in fact, actually, he did say that they couldn't see any more bone mets on the scan, so that's also a good thing. However, as we know, a CT scan isn't necessarily always just the best for bone mets and looking at them. However, anyway, that aside, but yeah, everything was like quite small to begin with, and then obviously I had this progression, this sudden surge when I got a lot more tumours in my liver, and they started to grow quite quickly, hence why I had to come off the hormone treatment and go on to the chemotherapy. And I was really hoping that I could get back to a point where I was either almost at that position again, or better, i.e., you know, even fewer tumours than I was originally diagnosed with. But I just don't think that's ever going to be the case. And I've been trying to get my head around that. And both Tim and I were talking to Sue about it yesterday, because there is the possibility of extending the chemo. The likelihood is it would only be for another 3 weeks. Both my new oncologist and Sue said generally people don't cope beyond about 21 weeks. They just say, no, that's enough. And Sue knows what I'm like. And she knows that I would push for as long as possible if I thought it was working. And by working, I mean just trying to blast the bastards as far as they can go away. But she's quite right, and I did have this thought before. It comes down to quality of life. And at the moment, it's crap. I haven't really got one. I can do bits and pieces, but even just having a one-on-one with someone who I haven't seen for a while really tires me out. You know, I can't taste things properly. I haven't really got the energy to go on long walks and just do all the things that Tim and I normally do. Go and visit people. Obviously, I'm worried about infection and all of that sort of stuff. And also, I know that I just can't keep on chemotherapy forever. However, I was just thinking they would keep me on it for as long as it worked, like they did with the hormone treatment. So sort of keep me on it. And I think mentally, yes, I was in a point where I was hoping that the chemotherapy would just blast the tumours and be done, so that I could be at a point where when I came off the chemo, I would almost be starting from a base level that was sort of almost like nothing, and obviously knowing at some point it would start sort of developing again. So what Sue has said is that it might be a good idea for me to get some help or therapy or something like that towards the end of the chemo, because I think I'm going to find that really quite hard, because all of a sudden I just know that I'm going to start thinking, oh Jesus, I'm off the chemo, it's going to start growing again, it's going to start growing again. And it might. I'm really hoping it doesn't, and whatever they put me on next, which is likely to be some hormone stuff, I don't know yet, will keep things stable. But obviously there are no guarantees in life, are there? But I know as soon as I come off this chemo, which is like a bit of I feel it's like a safety blanket, especially now that I know it's working, it's going to be really hard. It's going to be really hard for me. And for anyone who's watching this that's been in a primary situation, it's like when you finish your treatment for primary breast cancer and all of a sudden you're just left. You haven't got the safety net of going to hospital, seeing the nurses, having treatment, knowing that it's zapping all of the nasty cancer stuff. It's very similar to that. And you just feel a bit... And I've been through that once. And now I'm going to be going through it, but from a totally different perspective this time. Because I know as time goes on and things start getting worse, that the treatment options start running out. Now, I'm not at that point yet, but mentally I think I'm going to find that a real struggle. And I've already said to Tim, my God, once chemo finishes and before the scan after that, which is likely to be 3 months, because I was having 3 monthly scans, and I should imagine it will be 3 monthly afterwards, we should just try and fit in as much stuff as we can in between those 3 months, because I've got a list as long as my arm of things that I actually want to do, places I want to go, people I want to see. And to be fair, we were doing that before. Like last year, as most people know, follow my blog, I was just doing absolutely shed loads of stuff. It was brilliant, having a great time. But now even more so, it's sort of like coming to the fore for me. So I just wanted to let you know that that's what was happening. One thing I should also say is he mentioned something, because he was reading the report, and mentioned something about my lung, and that something that had been on my lung last time wasn't there anymore. And Tim and I were like, what? Lung? So no one has said anything to us about lungs before. So that was a little bit shocking. He said it might not have been cancer. He said, because quite often CT scans can show up like infections and all sorts. And when I think about it, it might have been, no, because I had a cold around my birthday, which went a bit chesty. But no, that the scan was before then. Anyway, it just concerned me that there'd been chat about my lung, and I was like, okay, so I didn't know that was going on. But that's not showing now on this recent scan. So whatever that was seems to have gone, which is good. So yeah, so I'm hoping that you can see how, whereas it is really good news that the paclitaxel has been working, I can't shout from the rooftops. I'm not really excited and happy. I really wish I was. But I just feel a bit, as you can probably tell, just a bit drained, a bit tired. You know, Tim and I are still trying to, laugh as much as we can when we can. And last night we had a bit of a chat about stuff. But, geez, this secondary breast cancer is bloody hard work, I tell you. So, yeah, so that's where I am. I've got number 12 on Thursday. Then I've got another 3 weeks, and then I've got a week off. And I'm really hoping that Tim and I can just get away for a few days. It'll have to be in this country, unfortunately. But yeah, it would just be really nice if that can happen. So just wanted to let you know how things are going, where we're up to, and I hope everyone's okay, and I will speak to you soon. Take care. Bye.